Incision Care. Introduction. Scar tissue where skin has been closed will be more noticeable if it is exposed to the sun during the healing process.
Select true or false.
Correct. New skin is very sensitive and can burn easily, which can lead to worse scarring if exposed to the sun. A doctor must remove staples and non-absorbable sutures after the wound heals.
Select true or false.
Correct. Absorbable sutures and skin glue do not require another visit to the doctor to be removed. Scar tissue is not as noticeable if absorbable sutures were used to close the incision.
Select true or false.
Correct. The look of the scar tissue is not necessarily a result of the type of closure used. All lacerations and incisions should be kept dry for a period of time after they are sutured.
Select true or false.
Correct. Incisions closed with glue can get wet because the glue acts as a seal that prevents water from getting into the incision. Sutures and staples should be kept dry for 1 to 2 weeks after they are applied. It is normal for an incision to have some bruising and drainage.
Select true or false.
Correct. Some swelling is expected. However, drainage and bruising are not.
Thank you for using Explain.